Strep throat is one of the most common throat infections. It is caused by a bacteria. Most often it is found in children within the ages of 5 to 15, although it can happen to kids who are younger or it can happen to adults. Kids under the age of 3 can get the infection, but it normally does not affect the throat. Normally you can get strep throat in the late fall, in the winter, in the early spring. Your doctor may call the infection acute streptococcus pharyngitis. You get strep throat by being in direct contact with any saliva or any nasal discharge from another person who has strep throat. They can infect you. You can get strep throat if you're in a very crowded environment. Normally don't get it from casual encounters with other people, but if you live in an environment like a dorm or school, you have a higher risk of getting the bacteria. Some people have reported that it has been in food such as milk and milk products which have caused the infections. Some of the symptoms for strep throat are if you have the infection, you will have a red and very painful sore throat. You might see white patches at the back of your tonsils. You can have the swollen lymph nodes on your neck, have a fever, you can have a headache, you can feel nauseous, vomiting. You can have abdominal pain. It can occur, but most common in children and adults. You can get sick within the 3 days after being exposed to the germ. Once you're infected, you have 2 to 3 weeks, even if you don't have any of the symptoms. After 24 hours of taking the antibiotics that you were prescribed, you will no longer spread the bacteria to others. Doctors figure out if you have strep throat by doing a throat swab to check the back of your throat for infection. This will be used for a laboratory test, or there's a rapid strep test, which only takes 10 to 20 minutes. If the tests come up negative, then you might have to do a follow-up test, which can take to 24 to 48 hours to confirm the results. Also, if your test is negative, your doctor may suspect that you don't have strep, but you might have some other kind of infection. Your doctor can decide what treatment is best for you because of the results. Most of the sore throats are normally caused by viruses, and if it is a virus, then the antibiotics is useless because it doesn't block against viruses. If you have strep throat, your doctor will prescribe you some kind of antibiotic. The antibiotic will help lessen your symptoms. And after 24 hours of taking the antibiotic, you will no longer be able to spread the infection to other people. Also, if you are taking any antibiotic, it can reduce the chance of getting any kind of complications. You may take the pills for 10 days, or you may be given a shot. You should start to feel better within 4 days. Even if you don't get any kind of treatment, you can start to feel better within 4 days. But it's still extremely important for you to finish all of your medicine to prevent any future complications from happening.